Curious. You wake up after a full night of sleep, but by 2 p.m., the brain fog rolls in. Maybe you've noticed your waistline expanding, a constant stiffness in your joints, or strange little skin tags appearing on your neck. We treat these annoyances as a normal part of getting older. If you take these complaints to a standard clinic, you'll likely experience what doctors call medicine 2.0. The physician plays a symptom matching game. Joint pain gets an anti-inflammatory prescription. Brain fog gets an ADHD script. High blood pressure gets a beta blocker. We should consider that these seemingly unrelated conditions actually share a single biological origin. The biological reality is that these symptoms are physical signs of a body suffocating in uncleared cellular trash. Your body is making more microscopic debris than it can clean up. The hidden culprit locking this trash inside your cells is the chronic overproduction of insulin. Insulin is a hormone your body naturally releases to manage the sugar circulating in your bloodstream. Escaping this cycle of physical decline requires us to stop treating the surface-level alarms. We have to look under the hood at our metabolic engine. Inside your bloodstream, insulin serves a specific primary role. It acts as a chemical transporter and a cellular insulator that shuttles glucose from your circulation into individual cells for storage. When you consume a carbohydrate-heavy modern diet, especially when you eat late at night, your body is forced to manufacture massive buckets of excess insulin to process that constant influx of energy. To deal with this massive surplus, your body takes the excess glucose and packs it into tightly compressed glycogen stores. Glycogen is a dense, packaged form of sugar kept in reserve for future use. This creates a biological blockade. As long as your insulin levels remain high, your body is locked in storage mode. You are biologically incapable of burning fat while that insulin is circulating. This high insulin blockade traps metabolic debris. It leaves things like amyloid plaques, which are toxic protein fragments, building up between the cells in your brain. It actively prevents your body from executing its nightly trash clearing routine. As long as your glucose engine runs hot and insulin stays elevated, your cellular repair sequence is suspended. Your cognitive and physical aging accelerates. To fix this blockade, you have to completely empty your body's glycogen tanks. And because those sugar stores are packed so tightly, it takes days of fasting and severe carbohydrate restriction to drain them. Once the sugar is finally gone, your body makes a metabolic switch. It adapts to the glucose shortage by starting to convert stored fat into energetic ketone bodies. Ketones are specialized chemical molecules produced by your liver to be used as an alternative fuel. These newly minted ketones are a cleaner biological fuel source. Burning them produces a smaller amount of cellular exhaust compared to burning glucose. This provides a distinct advantage for your brain. Glucose requires specific transporters to cross the blood-brain barrier. The blood-brain barrier is a highly selective membrane that protects the brain from harmful substances while allowing essential nutrients to pass. If you are insulin resistant, those transporters fail. But ketones bypass that requirement entirely, passing through the membrane to fuel your neurons. Entering this state reduces oxidative stress and lowers systemic inflammation. It revives insulin-resistant brain cells that have been struggling to stay functional. Ketones provide a repair mechanism. This is an evolutionary protocol designed to restore a degenerating brain. Refusing to tap into this ketone engine guarantees a steep price. It ensures a steady increase in cognitive decay and physical deterioration as the trash continues to pile up in your system. The first and most critical step to get there is behavioral. Stop all caloric intake after 6 o'clock in the evening. This chart shows exactly why timing matters. Notice how stopping meals early allows insulin to fall to baseline over an 8-hour sleep cycle. This gives your body time to clear out the trash before the morning cortisol spike triggers a glucose release at sunrise. Once you master the timing, you apply the next aggressive steps. Drop total carbs below 20 grams, increase your dietary fat, and introduce strategic fasting windows. These protocols are manual biological overrides. They are the chemical requirements needed to reset a metabolic trash can that has reached its limit. For patients with severe insulin resistance, making this metabolic transition is difficult. To force the issue, some doctors use a dietary intervention known as the 100-day Sardine reset. The logic is simple. Consuming only zero-carb, high-fat, high-protein fish forces a metabolism to rapidly deplete its glycogen reserves and enter ketosis. Dietary challenges of this nature generate public criticism. Some voices warned that an all-sardine diet would lead to heavy metal accumulation and toxic arsenic poisoning. But the clinical results contradicted those warnings. After 100 days on the sardine protocol, patient blood work showed zero arsenic toxicity. Instead, they recorded significant increases in natural vitamin D levels and weight loss. This physiological healing corresponds to tangible neurological recovery. One patient with Down syndrome and Alzheimer's lowered her insulin enough to speak her very first 3-syllable word after 41 years. Cognitive decline, brain fog, and chronic pain are simply biological check engine lights. You hold the power to change the fuel.